Vaccinations are among the most underutilized of adult preventive services, and this deficiency is the cause of an estimated 60,000 preventable deaths in the United States each year. Today we shall discuss the influenza or flu vaccine and the pneumococcal or pneumonia vaccine. There are many myths and misconceptions about these vaccines. The following information is based on the best scientific information available. The first myth is influenza is not a dangerous disease. The truth is, influenza causes 36,000 deaths per year in the United States, mostly in the elderly and persons with chronic disease, and it also causes 200,000 hospitalizations. Another myth is the flu vaccine causes the flu. The truth is, the vaccine cannot cause the flu. This is perhaps the most common reason this vaccine is not taken. Remember, it does not cause the flu. If you got the flu-like illness in the past after taking the flu vaccine, it was likely a bad coincidence and not caused by the flu vaccine. Please do not let this misconception keep you from getting a vaccine that can literally save your life. The next myth is the flu vaccine is dangerous. The truth is the flu vaccine is very safe except for persons allergic to eggs or having a history of a true serious allergic reaction. Signs of a true allergic reaction are lips swelling, breathing difficulties, or a choking sensation. The final myth is that influenza vaccine is not effective, and the truth is the vaccine is very effective, with up to 70% reduction in hospitalizations and up to 85% reduction in death rate from influenza. The pneumococcal or pneumonia vaccine has a similar story of myth and truth as with the flu vaccine. The pneumococcal vaccine can protect you against a bacteria that causes very serious infections that result in an estimated 300,000 hospitalizations and 15,000 deaths each year. As with the flu, most of the hospitalizations and deaths are in the elderly or persons with chronic disease. The pneumococcal vaccine is very safe and very effective, producing a 75% reduction in serious disease for vaccinated adults. The bottom line on vaccinations is get your vaccinations unless there is a real medical reason not to do so, and this is actually very uncommon. Also review the adult immunization schedule and the handouts you were given, and be sure to get all recommended adult vaccines as indicated in the handout. Depression is a very common mental health condition that causes a great deal of human suffering in terms of decreased quality of life. In its most severe form, it can be fatal as the result of suicide. Depression can be easily detected through a simple questionnaire, and the available treatment is safe and effective. Tobacco use is the single leading cause of preventable premature death and disability by causing lung disease, heart disease, and cancer. There are very effective treatments now available that can help motivated smokers to quit permanently. A final area we wish to present deals with the important issue of advance directives. These are legal documents. You use them to leave instructions for your wishes regarding your health care in the event you are unable to do so. There are two major forms of advance directives: the healthcare proxy and the living will. The healthcare proxy is a document that names the person who can carry out your healthcare decisions if you are unable to communicate them. You obviously should select this person carefully and make your wishes clear in advance. The living will is a document that declares your healthcare wishes to be carried out in the event of a terminal illness or a condition you are unable to communicate. These are two resources for you to obtain advance directive information, and you will receive a copy of this in your handouts today. You should always consider having an attorney check over these documents. This brings us to the end of this presentation. Your medical assistant will have given you a simple checklist and questionnaire corresponding to the preventive services covered in this video. You will have the choices of 1. Giving us your consent to provide or schedule the recommended service. 2. Letting us know you have had the service so we can update your chart. 3. Declining the service, or asking for more information before making your decision. If your answers regarding depression or tobacco use indicate the need, we shall provide you with educational material. This is an example of the checklist you should have. All that is required is your placing a check mark in the box of your choice for each category. In this first example, a red X is placed in the box that authorizes us to schedule you for a colonoscopy or sigmoidoscopy with an intestinal specialist for colon cancer screening. This next example shows a different choice by placing the X in the box that indicates your colon cancer screening is up to date. The rest of your checklist would be completed in this simple manner. If you have vision or other reading disabilities, your medical assistant will help you. We shall review this information with you and act on the recommendations and information in accordance with your choices. We hope that this video will have answered most of the common questions that arise and will allow you to make the most informed decision possible on these vitally important health issues.